Chlamydia trachomatis is the commonest sexual transmitted infection in Europe, and the incidence is actually on the rise and in younger women. The good thing is that it can be treated easily with antibiotics. The downside is it often does not cause any symptoms and therefore can go unnoticed. It can affect female fertility, mainly by damaging the tubes and causing pelvic infections. But there is evidence to suggest that it may affect the sperm in men as well. However, antibiotic treatment does not improve the sperm quantity or quality. Because of its long-term effects on fertility, it's imperative that we prevent as far as possible and treat wherever there is a risk. Therefore, any woman who seeks medical screening for suspected or possible exposure to chlamydia should be screened, should be offered screening and treatment. Anyone detected with chlamydia, all sexual partners, male and female, should be screened and should be treated so as to prevent reinfection. Testing. Chlamydia antibodies, serological testing can be done in the blood, and if it is positive, then may be offered other modalities like laparoscopy to check for tubal damage. However, even though chlamydia serology, which is the blood test, can prove or detect early infections, previous infections, it does not detect recent current infection. For current infection, one needs to have a swab to test the chlamydia DNA, and for that we need cells either on a swab from the vagina or from the cervix. Any invasive procedure in fertility, which may include testing the tubes with a dye, as in a HSG or HyCoSy, one should test and screen for chlamydia and should treat and cover with antibiotics the procedure. Or other invasive fertility procedures like egg collection also should be screened and covered with antibiotics. Couples going for egg freezing, sperm freezing, embryo freezing should also be counseled and appropriate action taken with regards to chlamydia infection.